Weight loss with PCOS is possible. Not only is it possible, it is likely. You just need to make sure that you're doing things correctly. Most things worth having seem impossible to achieve until it's finally done. And the same can be said for the topic that we're going to talk about today. If you are a PCOS youngling, or even if you are a Padawan, I just want you to know that you've come to the right master. That's right. I'm a freaking Jedi Master when it comes to PCOS, and I'm here to tell you all the supplements I've tried, what worked and what didn't work, so you can save your coins and gain some perspective. If you're new here, hi, welcome. My name is Tati. I've lost over 100 pounds naturally without any medications or surgeries. And also, this is Fred. He's my dog. He'll be joining us today. Today, I thought I would make a video that might be helpful to some people who are struggling with PCOS, with insulin resistance, or whatever other PCOS subsidiary you have. If you found this video and you don't have PCOS, I really don't know what you're doing here, but hopefully you find some information that's helpful too. I have my notes of everything I tried over here, so don't take anything that's said here as personal medical. Don't sue me, okay? Thank you. This is just my personal experience, and I'm hopeful that it can help somebody else out there. The first thing that I tried was a tea. I'm actually really big into supplements in general. I don't know, there's just something about the idea of a supplement that you can take and it can just be completely revolutionary or something that speaks to me, especially with teas. I'm just really big in general on teas. So the first thing that I tried was Spearmint tea. In PCOS, Spearmint is touted for its ability to either block DHT or block testosterone itself. I don't know. DHT is the most active, bioactive form of testosterone in our bodies. A lot of women with PCOS struggle with higher levels of testosterone than average, so Spearmint is touted as this thing that can kind of help with that. Some symptoms of higher levels of testosterone in women are things that we call virilization, which is, patterns of body hair growth in areas where women don't traditionally have body hair growth. This can be on your chin, on your chest, wherever. I can make a whole separate video about managing body hair if that would be something that you guys are interested in, because in addition to having PCOS, I'm also Middle Eastern. So that presents with its own challenges. And then the high levels of testosterone can also be responsible for like oily skin and acne and issues with your menses, etc. So I tried the Spearmint tea because it was recommended everywhere basically for PCOS, and I'm very easy to advertise to. So I bought it on iherb.com. Funny enough, my husband used to think that that was like a website that sold marijuana. It's not. They just like sell normal supplements. So don't be I don't know how the marijuana industry like owned the word herb like that, because other things are herbs, not just, the herb. But anyway, so don't be put off by the name. They sell really high quality products. The shipping was really fast, and then the product that I received was pretty good. So I tried this tea. I drink it every day for about 3 months, and I was like super hopeful that it would help with the excess hair growth that I have on my chin, because that's the area that I have some like darker hairs, right? And not only did it not do that, it actually gave me cystic acne on my chin. So I stopped drinking the tea once I realized that that was really the only new thing that I had changed. I don't have super acne prone skin to begin with. Like I'll get just like a random pimple here and there, but not really like that cystic deep acne that some people suffer with. So yeah, I'm pretty lucky in that sense. The other thing is, once I finally saw a gynecologist and did some testing for PCOS, we checked my testosterone levels and they were normal. So I don't know if maybe that's why the Spearmint tea didn't really do anything for me. If anything, it created problems for me. But yeah, that was my experience with Spearmint tea. So the next supplement that I tried were omega-3 fatty acids. So they're supposed to help with brain health as well as heart health, and then they also help improve hormonal function to allow women with PCOS to have an increased odds of being able to conceive naturally. Now, that's not something that I can really attest to. My husband and I aren't really trying to conceive right now, so I can't tell you whether it helps with that or not. Or, I guess if it does, it doesn't for me. So I took omega-3s on and off for 2 to 3 years, and really the only thing it did for me was increase my LDL. If you don't know, LDL is the bad cholesterol. That's the cholesterol that builds plaques in your arteries, increasing your odds of having a heart attack or stroke later in life. Everybody has some amount of LDL. You start building plaques in your arteries as early as like your late teens, I believe. But the higher the level is, the more plaques that you're building, the higher that you're increasing your odds of having those issues later on. So I was unaware of this, and I was taking omega-3s, and then my LDL was coming up as consistently high. So I stopped taking the fish oil, and my LDL came down a little bit. My LDL is still higher than is ideal, but it did come down a little bit once I stopped the fish oil. I probably won't take omega-3s again unless I am on a statin medication. Statins are cholesterol medications that help to lower your LDL. They're prescribed once your risk of having a heart attack or stroke due to your LDL being so high are above a certain threshold that overcomes the risks of being on a statin, basically. So it's always a cost-benefit analysis in medicine, right? So I'm not on a statin because my LDL isn't high enough. I'm not old enough to really be considered a risk for cardiovascular disease. And until I reach that level, I won't be taking omega-3s again because I don't need help having bad cholesterol, okay? The fact that I eat red meat so often does that by itself. I don't need help with that part of my life. Oh, another fun fact about about omega-3s is that they actually help with borderline personality disorder or BPD. So if you have BPD and you're watching this, just know that high doses of omega-3s, but they're like very high doses. They can help with the emotional lability that people with BPD can experience. I will say when I found the studies that looked at that level of the omega-3s, and I compare them to what was commercially available, I think like of the Costco omega-3s, the krill oil, I think, you would have to take 10 of them to meet the amount that was studied. So if you're going to take it for that reason, whether you have BPD or not, you just think that maybe you could benefit from some of its emotional and brain health things, I would recommend taking the extra strength omega-3 fatty acids that you can find. Another thing that I tried taking was magnesium. I tried taking this for probably 4 or 5 months intermittently. The first thing about magnesium is when you look at over-the-counter magnesium, there are several different types. There is magnesium oxalate and citrate are the most common ones that you find. Well, it turns out the molecule sizes of those are so large that they're really hard to absorb, and in fact, they can cause osmotic diarrhea, which is where, water flows the particle out with your stool, and then you have a more watery stool than you normally would. So just something to be mindful of. The type of magnesium that I used to recommend was magnesium glycinate, and I think I would recommend like 400 milligrams of that. So I believe magnesium glycinate is supposed to help you stay asleep, not necessarily falling asleep, but staying asleep. The other thing is that many women who have PCOS have lower levels of serum magnesium than healthy individuals, and we also know that magnesium helps with muscle contractions hypothetically. So it's supposed to help improve period cramps. I never saw any of that. I didn't see an improvement in sleep, but I sleep like a baby anyway, so I didn't really have to worry about that. I didn't see an improvement in anxiety. I didn't see an improvement in cramps or anything like that. So I stopped taking the magnesium because why would I keep paying for something that's not working? Another supplement that's regularly recommended to some women with PCOS and that is used in mental health, but that I have not personally taken is Chasteberry. It's also called something else that starts with a V, but whatever. So it's supposed to help with PMS and premenstrual dysphoric disorder, or PMDD, which is just like really bad PMS, like PMS with terrible consequences in your life and loss of functionality. So those symptoms are caused by the withdrawal of progesterone that occurs before women start our menses. And Chasteberry is supposed to help with progesterone levels in that time and to help kind of mitigate some of the symptoms that you have as a result of those changing progesterone levels. However, when I looked into the data behind this Chasteberry recommendation, I found that the population size that the recommendation was based on, like the study, they used a population size of 15 patients. And for me, that really wasn't significant enough to make a recommendation for people to be taking this as part of their, daily or whatever diet. Obviously, you're more than welcome to come to your own conclusions about Chasteberry, but it's just something that I guess like I use that more as something to be aware of, especially when it comes to PCOS. People love to tell PCOS ladies, oh, like you can get pregnant naturally, you can lose weight, you can stop having body hair. All you have to do is you have to pay me $100 for this freaking cactus and it's going to last you 5 days. It's totally within your ability to reverse your symptoms. You just got to give me all of your money and take this weird supplement nobody's ever heard of. So the Chasteberry story is more so to say, sometimes it's good to do our research and ensure that we're not taking anything like bonkers, okay? Or we're not taking anything that's been tested in like 3 women and those 3 women were like, it worked, and now it's being recommended by everybody. Honestly, you would be shocked, amazed, surprised, horrified by how often that happens in science and in medicine, where there is a study that's not exactly sound from a statistic basis, and then but you get so used to people citing the study, you never actually read the study yourself, and then those recommendations are just, given to patients without really thinking about them critically. So, and to be fair, like not everybody has time to be like a statistician or like a little detective, but us as ladies with PCOS, I will say it always pays off to be your own little detective, because a lot of the time you'll end up knowing more about what's going on with your body, what exactly is going on with PCOS, than somebody who doesn't specialize in it or doesn't have a vested interest in your specific health. In terms of PCOS, there are some people who believe that there are different types of PCOS. Some believe that they can have PCOS due to inflammatory reasons, or they can have PCOS due to insulin resistance. Not due to, but PCOS because of these things. One of the anti-inflammatory supplements that's regularly recommended is turmeric. The most bioactive form of turmeric after a slight bit of digestion, is curcumin, and curcumin is a strong anti-inflammatory, and people will take it for its anti-inflammatory effects. So it's recommended to women with like endometriosis, it's recommended to women with joint pain, etc., and also I guess men with joint pain as well. Something to keep in mind with turmeric that I was unaware of until I experienced it myself is that it can cause blood thinning and shedding of the uterine lining between cycles. So light blood discharge or light blood between your menstrual cycles. Because of that, when I take turmeric, I take about half the recommended amount on whatever bottle of turmeric I'm taking. I take the Cunol brand, it's from Costco, and I buy it on sale because it's expensive and I'm cheap. But anyway, so I take 1 capsule of that. 2 capsules are usually the recommended amount. And then I also skip it during my menses so that I don't have like double bleeding, I don't have extra thinning of the blood and more shedding of the blood. So yeah, that's just something to keep in mind with turmeric. I will say my personal experience is that I do have improvements in joint health. I am a very active person. I work out a lot. I walk a lot. I'm pretty hard on my body. So I really do notice when I'm having more pain that's when, maybe like there's no sale at Costco and I didn't re-up on the Cunol and I haven't been taking it in a few months. So I've definitely noticed that there is a difference in that for me pain-wise. I do have a friend with pretty severe endometriosis who has reported decrease in cramps and overall symptom severity on turmeric as well. So that's really great news, and I think it's a wonderful supplement to try. If you're going to try any supplement on this list, I would say it should be turmeric. The next supplement that I'm going to talk about is hotly contested because a lot of people swear that it solves like all of their problems related to PCOS. I took it for, I would say, 6 months, and I did not have a singular benefit. It's inositol, and there's different forms of inositol in the supplement that I took, but the one that I took is the one that everybody recommends taking, and it's on Amazon. It's like the specific form of inositol that helps with PCOS symptoms. So this supplement is supposed to help improve your insulin sensitivity if you have PCOS with insulin resistance. It's supposed to decrease your androgenic hormones, which are like your men hormones, testosterone, DHT, etc. And it's also supposed to help with ovulation. So some women with PCOS do not ovulate regularly. I do. I'm lucky in that sense. But a lot of women with PCOS do not ovulate regularly, and inositol is supposed to help with that. I took it for 6 months, and the only thing it did was give me insomnia and forehead acne. But I will say, when I made like a Amazon review and I wrote that in my review, the company reached out and provided me a full refund, which I really appreciated because it's not an inexpensive supplement. I do not recommend inositol. I had a really negative experience with it personally, and I think a lot of these supplements are touted as cures, but they don't actually help to benefit us. Another supplement that I personally took, but that is not regularly talked about in like the PCOS subreddit or forums or wherever else you're getting your information, is goat's rue. So I drank goat's rue tea every single day for about 6 months. It helped to lower my A1C to 4.2. A1C is like a measurement of your average blood sugar over the last 3 months. And a lot of women who struggle with insulin resistance or PCOS also have issues with their overall blood sugars and insulin levels. So goat's rue is actually what they use to treat type 2 diabetes in the Middle Ages. And it is like basically baby's first metformin. Metformin is made from the compounds in goat's rue. So I really like that. And obviously for me, it was effective because I was able to lower my A1C to almost hypoglycemic levels. So maybe a little bit too powerful. The only inconvenient thing about it, again, was just brewing the tea every day and drinking it every day. And I ordered it from iHerb. No, actually, I did not order the goat's rue from iHerb. I ordered that from Amazon. I'll pop up a picture somewhere about where I ordered it on Amazon. But I like that brand. I got several bags from them. I never had any issues, and the quality and the taste was pretty consistent. It's just a regular herbal tea. I don't know if you like herbal tea or not, but I do. So the taste is just very much like herbal tea taste. The next thing that I tried for PCOS was Ozempic or Semaglutide, the GLP-1s that are very, very popular right now, the ones that people are using to lose weight, whether appropriately or not. So it's not a supplement, it's a prescription. So you need somebody to prescribe it to you, ostensibly. Although I'm sure it's a little bit easier to get than it should be, knowing what's going on currently in the world of med spas. But anyway, I could not tolerate GLP-1s. I was on them, I think I did 3 months, then I took 2 months off, then I tried another 3 months. I did not lose a singular pound. And I titrated them correctly, and I was getting Ozempic from like a reputable source. I didn't lose a single pound, and I felt like I was gargling my own stomach acid at all times. And there are a lot of side effects of Ozempic. Part of the way that it works for weight loss is it slows down the motility of your gastric tract. So food is moving through your stomach slower, you're feeling full longer, etc., etc. It also helps to improve insulin resistance. It helps to improve, it does help insulin resistance by improving insulin sensitivity, so allowing your body to respond appropriately to insulin. The other really important thing to remember here is that fat is an endocrine tissue. Fat is not just fat. Fat also plays a role in releasing sex hormones. Okay, so if you're losing a little bit of fat and you're losing some of that sex hormone secretion, you can go back to menstruating regularly, right? So that's kind of the thought process behind how it can help you lose weight. It can help improve your insulin sensitivity, and it can also help you overall with your PCOS symptoms so that you can conceive naturally. I didn't have any of that. I didn't lose a single pound. I felt like I was gargling stomach acid because I guess it slowed down my gastric motility too much. I was constipated pretty much the entire time. And that's it. I did titrate the dose of the medication properly, but I couldn't surpass a certain amount because the side effects were so severe. And I don't know if maybe this is not common knowledge, but chronic heartburn actually changes the cells of your esophagus to the point that they can become precancerous or cancerous cells. So at one point I was like, I don't want to be doing this anymore. Not only is this a more novel medication, it's only been on the market since the 2010s, but I'm having such severe side effects that I think I'm going to give myself a second problem long term, right? So I stopped taking Ozempic. I have 2 other friends who have been Ozempic non-responders, which is so weird because I feel like nobody really talks about it. But yeah, I mean, I did not try anything else from that wave of medication. So really tirzepatide or Zepbound, I think is the name of that one for weight loss. I don't remember what the diabetes one is called. Yeah, no, wow. Brain is empty today, you guys. That's okay. It happens sometimes. But yeah, I didn't try that. I just kind of gave up on that entire process. It was also very expensive, so I just didn't want to deal with it. It was expensive. It was frequently out of stock. I was having severe side effects. I wasn't losing any weight, and I was miserable the entire time. I actually was taking Ozempic when I went on a trip to Korea, which was like a horrendous mistake because like a big part of the trip was eating, right? I don't know about you guys, but that's something I really look forward to when I'm on a trip. Not as a focus, but as a bonus, right? That's how food should be, especially if you have issues with eating. But I was so excited to be on this trip. We were eating a lot of street food. And one day my friends and I were we were eating street food in Korea, and I ate some fried food, and I literally couldn't talk for the rest of the night. And I'm like very dramatic when I don't feel well. I'm trying to stop being this way because it's like not an attractive quality, but I'm extremely dramatic when I don't feel well. So we were getting bingsu, which is like the shaved ice. And we're all sitting at a big table together. And my friends are trying to have like a jolly good time. And I'm just sitting there like, I don't feel good. Crapped on everybody's parade because I was taking Ozempic and it wasn't working out for me. I will never try that class of medications ever again. It just wasn't worth it for me. Okay, the last thing that I tried for PCOS is also prescription medication. It is Metformin. There are a lot of benefits to Metformin. Something that I really like about it is I believe it's been around since the 1950s or 60s, so it's an oldie but a goodie. I'm a little bit risk averse as a person in general, so I get a little nervous about taking medications that are novel or new because I feel like they're going to come out in like 10 years and be like, oh, we didn't know this when we released to market, but it actually makes you like grow a tail out of your butt, or like something crazy is going to happen and then I'm going to be stuck with the side effects. I mean, I will, like, I'm a baby, okay? I'm like very risk averse in certain ways. That's one of them. So for me, taking Metformin, I was a lot more amenable to trying it long term. I was on Metformin for about a year before I really saw any benefits, because what Metformin is meant to do if you have PCOS is to help regulate your insulin, so you're having insulin release and insulin response. One of my neighbors is driving by and their daughter is like standing up out of their sunroof, so that was weird. Anyway, one of the things that Metformin is supposed to do is to help women with PCOS have insulin release and insulin sensitivity akin to women without PCOS. A really frustrating part of PCOS is like, I really don't recommend going on a health journey with your husband if you have PCOS. I also don't recommend going on a health journey with a friend without PCOS if you have PCOS, because it can just be so discouraging. You'll go to the same exercise classes, you'll follow the same meal plan, and then you'll lose like 50 to 60% of the weight that your friends are losing. And a big component in that is, well, there's two big components in that. One is the insulin issue with PCOS. The other one is that women with PCOS tend to have lower muscle mass, so we have lower basal metabolic rates compared to women without PCOS. So Metformin isn't going to necessarily make you lose weight. You might lose some weight in the beginning because it causes a lot of stomach issues for people when they're first getting used to it. Like, it causes you to have diarrhea and you might be losing some water weight. If that's your experience with Metformin, please make sure that your doctor is prescribing you the extended release, not the immediate release version, and that'll be a little bit more gentle. I take 500 milligrams, which is like the lowest dose that you can be on. I should really be taking 1,000, but I don't know. I haven't done it. I don't know why I haven't done it. But anyway, and then the other way to mitigate the diarrhea issue is to take it with your biggest meal of the day. So again, the Metformin, and I did this for like a year. I took just Metformin, but I didn't do anything with my diet. I didn't change my diet at all, and I did not lose any weight. I believe I actually gained 7 pounds in that year. I remember because I was joking with my husband, because at the same time I had also started working out 5 days a week, and I was like, I started a medicine that's supposed to help with my insulin levels, and then I started working out 5 days a week and I didn't lose any weight. Like, I actually gained 7 pounds. That's bonkers. So you can't take Metformin and think that you will lose weight, because you will not. Okay, the Metformin is really there to help you lose close to the same amount of weight as somebody without PCOS would if they were following a correct diet. So I really say that Metformin helps with proportional weight loss ultimately, and that's what I experienced. When I put in the effort to lose weight while taking Metformin, I was able to lose like the projected amount of weight, which is really awesome because that hadn't been my life experience prior to that. I had a friend who started, well, I have a friend, we're still friends, who started Metformin recently, and she asked me if I noticed any sort of mood blunting or mood issues with Metformin, and I didn't. But so apparently insulin resistance is tied to all sorts of mood issues like anxiety and insomnia. So there is a chance that if you're on Metformin long term and your insulin and sensitivity to insulin is regular, is where it should be, that you'll stop having some of the psychiatric symptoms that are associated with PCOS. So that's everything that I tried with PCOS. Overall, I was able to lose over 100 pounds without any surgery, without needing to take any sort of like GLP-1 or anything. I did take metformin for the majority of that time at 500 milligrams with dinner. If you live in not America, I understand that it is much harder to get metformin prescribed to you for PCOS, whereas for me, I just literally had to ask my gynecologist, and then my primary care provider took over the prescription. So if it's hard for you, try the goat's rue, because I had very similar effects with the goat's rue tea, which was the metformin precursor that we discussed earlier. I guess the entire point of this video is that weight loss with PCOS is possible. Not only is it possible, it is likely. You just need to make sure that you're doing things correctly and you're doing things the way that you're supposed to, that you're not telling yourself that it's not worth trying, because I got sucked into that trap for years and years. That's my big message. Don't tell yourself you can't. It is harder, sure, but that doesn't mean that it's impossible. I did it and I'm basically a buffoon, okay? I'm like a clown here for your entertainment, and I was able to lose over 100 pounds. I ate a cookie today for lunch, and then I had an ice cream cone again for lunch. Today is not a good day for me. I haven't done the best with my diet. But if I can do it, if I, a buffoon, can lose over 100 pounds while having PCOS, then surely you, a non-buffoon, can utilize some of the information that I discussed in this video to enable yourself on your own weight loss journey. Buffoon to non-buffoon, I got you, okay? I really hope that you guys found some of the information in this video helpful. I make about one video a week. It's the best that it's the best that I can do right now, but I'm trying to push myself to make more because this was always my dream, and now I'm trying to actually achieve my dream, whatever, okay? Thanks for watching. Is Fred viewable? There he is. Freddy. He says hi.